practitioner. I'm going to be doing a head-to-toe assessment on you today. I have washed my hands and provided privacy. Can you tell me your name and what brought you here today?
My name is Hans Simeon, and I'm just here for a checkup.
Okay, perfect. So to start my head-to-toe exam, first I'm going to be looking at the patient's appearance, and he does appear to be well-groomed and good hygiene, and there's no obvious abnormalities. I am going to start with the head, just looking at the scalp, parting in different areas. There is no lesions noted. I'm going to palpate. There's no lumps or deformities. Did you have any tenderness?
No.
Okay, next looking at the face. The face appears to be symmetrical. I'm going to go ahead and palpate that frontal lobe and the maxillary. Any tenderness?
No.
Go ahead and palpating that temporal pulse. No. 2+ and equal bilaterally. Okay, I'm going to have you smile for me, checking cranial nerves 7 and 12. Smile and puff out your cheeks. And raise your eyebrows. And open your mouth and stick your tongue out. And move your tongue side to side. Perfect. Those cranial nerves are intact. I am going to next move on to your eyes. I'm going to shine a pin light in your eyes. It's going to be bright light. You just look ahead. Pupils are equal and round and reactive. I'm going to go ahead and test your sensation. I'm going to have you close your eyes. I'm going to touch this Q-tip on your face, and you tell me where you feel it.
Forehead, right cheek, left cheek.
Perfect. I am going to have you follow this pin light with your eyes and not your head. Perfect. Cranial nerves number 3, 4, and 6 are intact. I am going to have you look at my nose and then tell me how many fingers I'm holding up.
2, 2, 2, 2.
Perfect. Cranial nerve number 2 is intact. I'm going to go ahead and take a look at your ears. Looking at your ears, there's no obvious abnormalities. I'm going to go ahead and palpating that tragus and that mastoid process. Did you have any tenderness?
No.
And again on the other side. Any tenderness?
No.
Perfect. Looking in the ear canal. And that tympanic membrane is pearly and gray, which is good. Looking on the other side. And that ear canal. And that tympanic membrane is also pearly gray, which is good. Next, I'm going to be moving on to your nose. I'm going to have you look up for me. The mucosa is pink and moist and intact. I'm going to have you close your eyes and smell this and tell me what you are smelling.
Vanilla.
Perfect. You can open your eyes. I'm going to look into your mouth. Can you open your mouth and stick your tongue out? Perfect. The uvula does rise and is midline. Can you raise your tongue and touch the top of your mouth? Perfect. You can close your mouth. Next, moving on to testing your hearing. Do you hear that?
Yes.
And that?
Yes.
This is the Ren test. You hear it?
Yes.
And that?
Yes.
Perfect. And the Weber test? Do you feel that in both of your ears?
Yes.
Good. I'm going to go ahead and have you stand up, and I'm going to have you look over here and read number 4 for me.
LPED.
Perfect. You can have a seat. Wonderful. Next, looking at your neck, there is no JVD noted on both sides, and the thyroid appears to be normal. I'm going to go ahead and palpate. I'm going to have you swallow for me. Perfect. No thyroid enlargement noted. Checking those cervical lymph nodes. Did you have any tenderness?
No.
Perfect. Gonna go ahead and palpate that carotid pulse. It's 2+ and equal bilaterally. I am going to go ahead and have you take your shirt off for me. I'm going to go ahead and look at the chest. The chest appears to be symmetrical. The abdomen is, there's no abnormalities noted in the abdomen or the chest. Can you take a deep breath for me? Chest expansion is symmetrical. So I am going to go ahead and palpate his lung fields. Percuss the lung fields. Can you lift this arm up for me? Perfect. And turn to the side. I'm going to do your back. Percuss your back. Resonance is noted within, without, throughout. I'm going to go ahead and check for tactile firmness. Can you say 99?
99, 99, 99,
Wonderful. I'm going to do that on the front.
99,
Mm-hmm.
99, 99.
No consolidation noted. I'm going to listen to your lung fields. I'll have you take a deep breath. Perfect. No adventitious lung sounds are noted. I am going to go ahead and have you lay back on your back so that I can inspect your heart and your abdomen. First, I'm going to palpate that precordium, that PMI. There are no thrills noted. I'm going to go ahead and listen to the carotid with the bell of my stethoscope. No bruise noted. Listening to the heart sounds, the aortic, pulmonic, tricuspid, the Erb's point, and the mitral valve. And again, listening with the bell of my stethoscope in the same areas. There are no bruise noted. I am going to go ahead and percuss the heart borders. Perfect. There is no cardiomegaly noted. I'm going to go ahead and look at these. Can I have you turn your neck that way? I'm going to look at that JV. No bounding or pulsing noted. Can you turn your head the other way? down to the abdomen. The abdomen appears normal and symmetrical. I'm going to go ahead and auscultate, listening in all 4 quadrants. Bowel sounds are active in all 4 quadrants. Next, I'm going to go ahead and listen to those arteries, starting with the aortic and the renal. And this is with the bell of my stethoscope, listening to the iliac, and voicing that I did listen to those femoral arteries as well. I'm going to go ahead and listen to that liver and the spleen. Perfect. No friction rubs or bruise noted. Next, I'm going to go ahead and palpate that abdomen and all 9 quadrants, percussing. Resonance noted throughout. Go ahead and percuss for that liver border. No hepatomegaly noted, and going ahead and palpating for that, percussing for that spleen. Perfect. No splenomegaly noted. Next, I'm going to go ahead and palpate, starting with light palpation in all 9 quadrants. Do you have any tenderness?
No.
Perfect. Next, going in with deep palpation. I'm going to go ahead and check for that Ravisving sign. Any tenderness?
No.
And checking for Murphy's sign. Can you take a deep breath? Any pain?
No.
And then checking that McBurney's point. Pain?
No.
Okay. Moving on, I'm going to go ahead and check the psoas sign. I'm going to have you uncross your legs for me. I'm going to put some pressure on this knee while you raise your leg up. Any pain or tenderness?
No.
So the psoas sign is negative. Going ahead and doing that arbitrator sign. I'm going to lift your knee up and rotate it inwards. Any pain?
No.
Perfect. The arbitrator sign is negative. I'm going to have you just sit up. You don't have to put your legs over. I'm going to go ahead and check for CVA tenderness. Pain?
No. No.
Perfect. I'm going to have you lay back, and I'm going to go ahead and do range of motion in both of your legs. Checking your ankles. And push. Strength is good. Checking that knee. And that hip. Good. Full range of motion. Going to do the other side. Can you push your foot? Perfect. The strength is good as well. And rotating that knee and that hip. Range of motion is full and intact. You can go ahead and sit up for me. Next, I'm going to check for capillary refill in the lower extremities, which is less than 2 seconds. Can I go ahead and check your fingers? Capillary refill is less than 2 seconds. Checking skin turgor, which is normal. I am going to go ahead and palpate these pulses, starting with the radial, 2+ and equal, brachial, 2 plus and equal. Going ahead and doing this. 2 plus and equal, and that posterior tibial. 2 plus and equal, that dorsalis pedis. 2 plus and equal bilaterally. I am going to have you stand up and walk back and forth for me, checking the gait. The gait is steady. Next, I want you to walk on your tippy toes. And when you come back, I want you to walk on your heels. Perfect. The gait is steady. While you're standing up, I'm going to go ahead and check your flexion. I'm going to have you bend over. While you're bending over, checking that spine. The spine is intact and symmetrical. Perfect. You can stand up. Take a few steps forward for me. Perfect. And bend backwards. Okay. And I want you to turn side to side. Perfect. And bend side to side. Yep. Perfect. You can have a seat for me. I am going to go ahead and test your sensation. I'm going to have you close your eyes. I'm going to use the soft part of my cotton swab and the hard part. I'm going to have you tell me where I'm touching and with which. The soft or
Left
the hard?
arm.
Is it soft or hard?
Hard.
Okay.
Right arm hard.
Perfect.
Left foot soft.
Perfect.
Right foot hard.
Perfect. I'm going to go ahead and have you put both of your arms out and turn your wrist over, bring them up, and have you pull my hands. Strength is good. I'm going to have you put your arms out like this. I'm going to push down and pull up. The strength is good. You can put your arms down, and range of motion is good as well. I am going to go ahead and, excuse me, check these reflexes, starting with the bicep and the tricep and that brachial radialis. Perfect. And doing the other side. Go ahead and do the reflexes down here. And then your other knee. And that Achilles. Perfect. I am going to have you do that Tennel and Fallon test. I'm going to have you put your wrists together. Do you have any numbness or tingling?
No.
Okay, and then hold your wrist out for me. Any numbness or tingling?
No.
Perfect. I'm going to have you go ahead and do some other tests. I'm going to have you touch your nose and then touch my finger. And touch your nose. Perfect. Now we're going to do some rapid hand movements. I'm going to have you do, wonderful. You can stop. I'm going to have you do a knee to shin or heel and shin test. I'm going to have you put your heel on your knee and run it down your leg. And do the other foot. Perfect. I'm going to have you stand up. I'm going to do the Romberg sign. I'm going to have you close your eyes and stand. Put your feet together. Perfect. No swaying is needed. You can have a seat. I am finished with my exam. There are no other things that I have for you right now. I will complete my assessment by documenting everything. Did you have any questions?
No.
Perfect.